So many questions exist when it comes to antibodies and COVID-19 immunity. Now, the University of Minnesota Medical School is part of a new national network dedicated to seeking those answers over the next 5 years.
It's not still clear why some people don't develop antibody responses and why some people's antibody responses are stronger than others. It's also not completely clear how long antibody responses are going to last. So
Dr. Amy Karger is the principal investigator for the initiative.
Why do you think the U of M Medical School was chosen to be a part of this?
We did develop our own antibody method at the university, and our method is semi-quantitative, so we can actually tell the level of antibody response that a person has, whereas most antibody tests out there only give a yes/no answer. You're either positive or negative. And that's one thing they're wanting to better understand.
Dr. Karger says the state's early investments also put them in a good position for this opportunity. The U Medical School's Department of Laboratory Medicine and Pathology is one of 4 capacity building centers in the country, aimed at increasing the nation's antibody testing capacity with a $6.7 million grant. Part of their work includes comparing different methods to discover which antibody tests are the cream of the crop.
I think the most important thing is just ultimately understanding how we can recover from this virus, how people recover, what antibodies mean. And I think another key thing in terms of antibody research that is in the future, but hopefully will be soon, is understanding antibody responses to the vaccine. That's going to be a really critical piece to understand as vaccines get deployed. And this network of institutions is going to work to study that as well once vaccines are utilized on the general public.
Heidi Wickdahl, KARE 11 News.
The U will be collaborating with more than 25 institutions on the initiative as part of the Serological Sciences Network. In the next few weeks, researchers at the U will be looking for volunteers to be part of the study.